brief you regarding the CME activity that we are going to organize tomorrow. The HIV, as we are all aware, has been a global health problem. The treatments have really made a lot of difference, and it has now become any disease like diabetes and hypertension. But still there is always a need to do better than what we are doing till yesterday. A lot has been achieved in the program, but still there is a need of increasing awareness amongst the young bunch of residents who come here to train in PGI, young doctors, doctors in the peripheries, allied health specialists, nursing staff. So as a mandate of Center of Excellence in HIV care, we have taken upon us to sensitize and resensitize people about the ever-changing and ever-expanding field of HIV care in India. The couple of things, we will share a presentation also. I will just wish to highlight few things. There have been few new initiatives that we have taken in the recent past. We have started telementoring for the regional ART centers. So that is number one. So previously what used to happen, that the patients who were failing, we were mentoring the ART centers from Jammu and Kashmir, Himachal, Haryana and also Punjab. Recently we have started mentoring them through live telemedicine sessions. So those patients who are not doing well, we are fixing up the state clinical expert panels, wherein we are seeing what they are doing and we are hand holding them in trying to improve upon where they are. So we held the setups with the Rohtak centers and other centers also recently. So we are not only providing care here, but PGI is also expanding care to the ART centers in the surrounding states. That's point number one. Point number two was, as you would be aware, that Chandigarh was number one amongst all the ART centers in the country in their review, 360-degree overall review last year. And in a recent meeting which was held for the review in Bangalore, the Government of India has decided for 95 targets, which means that those patients who are on treatment, 95% of the patients should be, when we do viral load, the viral load in the blood should be suppressed. So the target is 95%, but our rate was 97%, more than 97%. And we were, even viral load suppression also, we were leading the country. There are more than 600 plus ART centers, I think, and there are various states. So the good thing was that from Chandigarh has two ART centers. One is PGI and the other one is our ART center in GMCH. Large load is taken by PGI, but some part is also, which is also mentored by PGI Chandigarh. So Dr. Shankar had attended that meeting there as a deputy program director, and we are already meeting that target, which is good. The national, just to give you a perspective, the national average is, I think, somewhere around 74-75% of viral load suppression, whereas in PGI it is 97% viral load suppression. So this is the ultimate benchmark of the quality of care which is being provided. Last year we had shared a news that we had talked about care being provided for patients who have a failure in the brain, which is we call HIV CSF escape failure. We are working on various aspects in these patients, as you will see. The other thing that we have started in the last few years is that TB was a very common infection in HIV patients, and both HIV and TB are treated under the national program. Previously the treatment was, HIV treatment was being given here, and the TB treatment was given at the DOT centers. For some time now, the TB drugs are also being provided by our staff only, so that the patient this is as per the national policy. Our staff only is providing the TB drugs also. So these are the messages which need to go into the lay public, because We all have to hold hand and increase the awareness that not only it's like a manageable disease, it's no longer a death sentence. Even if comorbidities like TB or co-infections like TB occur, you don't have to shuttle from one place to the other. The TB treatment also can be given here. Opportunistic infection treatment can also be given here. And the other thing, since these roughly हम expect कर रहे हैं कि 200 plus होने चाहिए,